Yes, hello and welcome to this webinar, and welcome to you, Søren.
Thank you.
It's a pleasure to have you here.
Pleasure to be here.
So we have a big audience today. So we have more than 200 sign-ups for the meeting. So together with us we have many CMC managers, QC specialists, and analytical scientists. So it's a pleasure for me to welcome you here today to discuss analytics for HCP analysis and strategies for HCP analysis. So Søren will give a talk on the strategy that they have used at Genmab, and give examples and data on that. So you're welcome to ask questions to Søren. So please write them in the chat, and then we will take them in the live Q&A afterwards. So Søren, he's a senior CMC specialist from Genmab in Denmark. So Genmab is developing a lot of monoclonal antibodies, and some of them are on the market, and they have many more in the pipeline. So Søren has a background in CMC in different companies, and he also has a scientific background in protein analysis and mass spectrometry from the local University of Southern Denmark here in Odense. So with that, Søren, welcome.
Thank you.
So I'll just go into screen share mode, and then hand you over to Søren. So Søren,
thank you.
Ahead.
So welcome to this webinar, where I will be talking about a HCP Control Strategy Part 1. This is what we call experiences from an off-gel road, and why that is, we will get back to. So just a general introduction to those out there that are not that familiar with HCP. There's a USP monograph called 1132, very famous by now, for people in the field, that says residual HCPs have the potential to affect product quality, safety, and efficacy, and therefore the quantity of HCP should be low. So of course there's a huge focus on having the right methods, the right reagents to sort of demonstrate this control of HCP and the control of the HCP levels. And of course this is associated with the fact that these residual HCPs have a certain risk for patients. There's potential immunogenicity, there's adverse effects, but it also has some risks for the product itself, especially in this case we talk about mAbs, or the mAb stability, and even the excipient degradation. So in Genmab we had a discussion around how do we control this HCP, and here's sort of a very overall schematic of different ways to control HCP. And in a very classical way, you have this ELISA only, as we call it. Perhaps you start out with a commercial ELISA and you change during your development to a process-specific ELISA. However, we wanted a bit more. At some point, there was a boss who asked me, "So, Søren, do we actually have any issues with HCP? Do we have HCPs in our product that could potentially affect the stability?" And at that point, I couldn't ask him, or I couldn't answer him. I didn't know. We had this ELISA only approach, so we could get a number on a CFA, but we didn't really know what that meant. So we choose actually to look at this part here, the ELISA and MS part, where you combine what you say the classical ELISA approach, in this case a commercial kit, with mass spec characterization. And we did different approaches, and I'll give some examples here. So again, most control strategies are based on ELISA, especially in an early development, and it's basically a specification testing. So you get a number, and that is what you release your batch for. However, we see both, of course, on my side that I has a mass spec background, but we also see a field that is moving towards sort of different mass spec based methods to sort of enhance your knowledge of how your reagent performs and how your process performs. And this is why we call it off gel, because there's been a tradition as well, the way you look at this ELISA reagent, you look at this coverage, but that has been based mostly on performing a 2D gel analysis to see how well your ELISA reagent performs. The problem is, or the challenge that we saw is, even though you do this gel, you still don't really know if you have any issues with HCPs. You still have HCPs in there that could be a problem for your patient or a problem for your product. So what again, as I said, what I present here is a part one of what we call a holistic HCP control strategy. And the parts that I will discuss here is one, how we identified HCPs by LC-MS, how we made a screening or selection of, in this case, CHO anti-HCP reagents using this approach called ELISA-MS. I'll go into that a bit more. And of course, also we try to compare that ELISA-MS method and compare that to other methods to do coverage. So I'll start out with this LC-MS characterization of what we call an HCP profile. And that was actually the first step that we did for this HCP control strategy, basically trying to understand how our process performed, how our production process performed, and also if there were any HCPs in our sort of final product. The characterization was performed using LC-MS with this called DIA, which is data independent acquisition. We did the analysis on 3 in-process samples. We did it on Clarified Harvest and 2 chromatography steps, and of course then also the bulk product. And what we did realize was that our process performed or they had a really good clearance. So we started out in our Clarified Harvest sample approximately 800 proteins, but as soon as we passed the first chromatography step, we were down to 72, and another chromatography step we were down to 4. And in the end, we only had 3 HCPs left in our bulk product. One of them was actually a bit of residual protein A from the chromatography step, the first chromatography step. There was a second one and a third one. And the second one turned out actually to be a problematic HCP. And you might wonder, what is a problematic HCP? It could be sort of a general description of a HCP that either had knowledge around, it gave immunogenetic reactions early on, or it could be a HCP that has creates a problem for your stability of your product. So what did we understand from this? How does this approach sort of contribute to our HCP control strategy? Well, first of all, very importantly, it showed you how our process performs. If we had a different result, that our process was less efficient in removing HCPs, we would have had a chance there to optimize the process. We also, as I said, we gained knowledge on the presence of the HCPs in the actual product, and was it problematic ones? And there was one. And also we actually used this data to perform coverage assessment of the ELISA reagent. What we also thought of, and this is something we're still looking into, is that you could use the protein A flow-through to further characterize HCP. Because when you do that, you actually deplete your HCP sample from your product, leaving a more pure HCP sample. Because when you do this, you actually analyze your sample that includes a lot of your product. So it might give you, by doing this, it might give you a better knowledge around your HCPs. So the second part, or the second angle that we took for this control strategy, was that we looked and screened different commercial HCP reagents. And we actually evaluated 11 different commercial kits. We did a total of 4 suppliers, and we took up 7 reagents from an initial valuation and used those 7 reagents and evaluated them by ELISA-MS. We used 2 different harvest samples from 2 different processes from the same CHO cell line. We used this ELISA-MS method that has been published some years ago by AlphaLyse. I won't go through into the details. You can see the reference in the corner. But basically, the principle is that you capture your HCPs in your ELISA plate with your different reagents. So in this case, we screened these 7 different reagents using this method. And what we came up with was this. So again, we used 2 different process samples. And what we ended up came up with were 2 of the reagents that showed the best coverage. I might use this here to show you that, well, there was an overall coverage around 40 to 45% across the 2 samples. What is also interesting is, of course, your coverage for higher abundant HCPs, so HCPs above 500 ppm, you are around 70 to 80%. So you had a pretty good coverage actually for higher abundant HCPs. What we further looked into, so this was a coverage analysis performed on a harvest sample, but we also looked into what, since we already did the HCP profiles on the bulk samples, on the bulk antibody samples, we could also look at what kind of, well, if the different reagents actually covered the HCPs that were present in the actual product. And again, we found one reagent that was a bit more, or that was superior to the other one, because it could actually identify all of the HCPs that was present, or it could detect, I would say even more, all of the HCPs that were present in the different bulk samples. Again, what did we learn from this approach? How does this contribute to this overall control strategy? Well, one thing is that we had a chance to really screen commercial kits, commercial anti-CHO HCP kits, and figure out which one was the most optimal for our process. Again, when you start a product, when you start a new project, you don't want to start up and using or creating a process-specific kit from the beginning. So this is a really good way to find a commercial kit that was really available and use that and screen that and find the one that is more suitable for the process. Second of all, what we also realized was, does it actually detect what we think or that we know is present in our final material? It's fine if you have a huge coverage, if you have a high coverage number, but if it doesn't really detect the HCP that is present in your product, is it then relevant? And sort of the last approach that we did, we compared different methods for this coverage analysis. There was this very, very classic way to do this, what we call a 2D gel. In this case, a 2D fluorescent Western blot, where you fluorescently stain your harvest sample, you run that in a gel, and then you incubate with an anti-CHO HCP reagent, and then you detect that with a fluorescently labeled secondary antibody. A second method that we screened was the 2D DIGE. combined with immunoaffinity chromatography, again using the HCP reagent of choice. And then you compare that with the fluorescent labeled harvest sample. And the final approach is the one we already used for the screening of these commercial kits, the ELISA-MS approach. And what we saw were very different results. So this is the more classic 2D gel approach with a Western blot. And here you ended up having a coverage number of about 28%. So in that light, our reagent didn't look very good. However, the next one was the 2D DIGE immunoaffinity chromatography approach, where you coat a column with your reagent. You flow through your harvest sample to enrich for HCPs, and you compare that back to the harvest sample. And you run this using a gel. And here we actually obtain a coverage of 81%. So the same reagent, which made it look really good in a way. And then we also choose to do this ELISA-MS, where we had a very different coverage, either 70% or 55%, it depending on the way you did the data processing. The first way, the method A, you used a 1ms analysis of a harvest sample and compare that to the immunocaptured HCPs in your ELISA plate. You could also compare sort of a dilutional series of your harvest sample with the same immunocaptured HCPs and get a slightly different coverage. What we also found interesting here again is this also gave us information around what kind of size proteins were covered the most. And as you can see here, especially proteins above 20 kilodaltons are really highly covered, whereas proteins below 20 kilodaltons is not so well covered. So using MS data and MS analysis gave us actually a lot of different knowledge. What we could see from our ELISA-MS actually that the reagent that we used actually covered quite well all of these 4 quadrants of the PI molecular weight plot. But what we also looked at was how did the kit standard, the HCP reference standard, how did that perform? And we realized that it was quite important that the kit standard in that commercial kit that we used needed to be representative of our process. So again, we did process samples and compared that to the reference standard from the kit and realized that up to 91% of the proteins were matched. So again, we could use the kit standard as a representative for our process. Again, how does this contribute to our HCP control strategy? Well, one thing is that the coverage number that we obtain is relative. It depends on a lot of parameters. It depends on the methods that you choose and many of the method parameters that you have. The way the data is processed can also, of course, impact the amount of your HCPs identified. And what we found the advantages using ELISA-MS compared to the gel-based one is that it's also sort of a situation that is very close to a normal testing condition. So in the lab, in the QC lab where you release your batch, you would use ELISA plates and an ELISA approach to obtain a value that we used for a C of A. So we also saw that we can use a representative sample from the process. The issues with the gel-based one is often that if you use a representative sample from the process, you have all of these product spots or product bands that might interfere with your analysis, but in this case, it does not interfere. And again, also you could, the gel actually has the ability to denature your sample, whereas in the ELISA-MS approach, you actually perform the analysis in a native condition. What we also saw is that sometimes the product interference is overestimated, up to 94% or 49 spots were product related. And even though we had the 2D DIGE immunoaffinity chromatography approach that was close in a certain way to the coverage number from the ELISA-MS, we also know that it can actually boost the coverage number because it has the ability to enrich for low abundant HCPs. And this is the approach we call pick a number, because as you can see, many of the approaches gave very different numbers. And even within the ELISA-MS, the way you do your data analysis, you can have the different coverage numbers. So a little conclusion to this. So we find that sort of LC-MS for HCP characterization is a very powerful tool. It's not a perfect tool. I know there's a lot of people out there that has issues with quantitation, so on and so forth, dynamic range, sensitivity, and so on and so forth. But we found it to be a very powerful tool to characterize your HCP profile, to understand your process, to understand how your process clears for HCPs, to identify any issue or any problematic HCPs in your product, but also to evaluate if there is a process change, how that impacts your HCP profile. And combining the MS with ELISA, again, has the ability to really evaluate and screen for HCP reagents so it can fit your purpose. It does determine coverage in line with a 2D DIGE approach. If you want to look backwards a bit. But it also is a situation, as I said, that it really mimics a release situation. So we found that very valuable as well to be able to do that. But what I will also say is that we have many more experiences. So stay tuned for part 2. That will be sometime in April, I believe. That is not from an off-gel experience, but from an off-ELISA experience, where we actually look at using LC-MS for assessing process changes, how we demonstrate HCP clearance across batches, how we document the process consistency, and most importantly, and very for many people very interestingly, how this control strategy actually provided feedback from the health authorities, because I'm sure there is a lot of people out there saying, "What, Søren, how did the health authorities react to this?" So stay tuned for part 2 for this, because there will be more around this. So thank you.
Thank you very much, Søren, for a very impressive talk. So I'll just stop sharing the slides here and then switch back to camera. So here we are. So yes, please, while Søren is getting his breath again, then please type your questions in the chat box, and then we will go through them. So I have some questions here. I will read to you, Søren. So were the kit standard HCPs present in equal amounts to your harvest sample?
Oh, that is a really good question. No, I don't think so. But I would need to look back into that report. That's been a while ago since we did that. But my guess would be no. I think we look more on the ID than the quantitation.
And another question here. Have you validated an MS-only HCP method for GMP release?
No, but I wish I did. I wish I had. I think this is something we would really like to do on the long term. We see a lot of challenges going forward with a lot of projects using this ELISA reagent. So I wish I could use a more MS-based method for GMP purposes, I would really use that. We've been talking a lot about this because, in a sense, we see a MS-based method as a way, as a method that can learn. The more samples, the more batches, the more projects you can run on the MS, the more knowledge you can gain. So we see this as sort of an MS-based method as a method that can learn. So the more you use it, the better it can get, because you will gain knowledge around both for your specific project. You can gain knowledge for your different platforms, for your different projects, but you can also combine an MS-based method with method or information that is coming from publications, from people who realize that there's been a problematic HCP for public and semi-public databases. You can integrate that. You could combine that with, if you have process enzymes you need to monitor. So all of that could be combined in one method optimally, that could continue to learn as long as you use it. And you would never have any method that you need to bridge or change reagent or change supplier, but we just see an MS-based method that is also benefiting from technology improvements, because MS has been improving a lot for many years, and speed, sensitivity has been increasing. Whereas I see an ELISA-based method as a bit more static in a way.
So Søren, yes, so many great perspectives for using mass spec as release test in the future. So we're not quite there yet. So I think already you showed a new approach that you were looking at commercial kits, whereas the general belief in the industry used to be that you had to develop a process-specific ELISA in late stages. So why did you come up with this strategy, and why did you think it could work? And what are the reasons why you could look at this strategy? Could you take us into your thoughts back then when you looked at what should your strategy be 5 years ago?
Yeah, I think we were working on a project that was accelerated a lot. So we could see that developing a process-specific method would not perhaps meet any BLA timelines that we had. So in that sense, it was a lot easier to take something from the shelf, a commercial kit. And that's why we did this screening to see, okay, which one actually fit our process the best. So that was basically that. That was a timing perspective. Of course, when we started looking into it using MS, we realized that it actually worked pretty well. And as I said, it covered the HCPs that was present in our product. So that's why we saw an opportunity to continue with this, because we felt and we had the data that could show we had our process pretty much in control. And we were actually confident that that story would stay with the authorities and be accepted by the authorities. So that was our line of thought.
Mm. So at what stage would you recommend to do such a detailed coverage assessment? That's one of the questions here.
Okay. Well, I would actually try to do this as early as possible. You might be able to say, well, do you want to put a lot of effort in very early stage of first human dose? But I think especially using the ELISA-MS is relatively easy. It doesn't take a long time, but it does provide you with a lot of information. It does provide you with information about your process, not just your reagent. Of course, that's the main purpose, to look at your reagent, but you also gain knowledge around your process and how that performs, and how that HCP profile looks in your product. So you gain a lot of knowledge on a very early basis, especially if you have problematic HCPs that suddenly end up being an issue for your product stability. Then I would know that as soon as I could.
So basically do the coverage assessment for the ELISA using as early as possible.
As early as possible.
Yeah.
Also, if you need to know, if you realize that there was not really a commercial kit available, then if you feel sort of obliged to do a process-specific HCP, you will need quite a bit of time to do that, and it might not be successful the first time around. So again, the knowledge that you can get earlier, the better, in my opinion.
Mm-hmm. So then you realize you have to do a coverage analysis, and then you can choose from these different methods, and people tend to be quite focused on what should the coverage percentage be. It should be better than 70, or for maps maybe even higher. But you clearly demonstrate that different methods give different numbers. Pick a number.
Pick a number.
Even the same method can give different numbers. So how do you deal with these differences, and what do you report to the regulatory agency? What data do you submit to them?
Well, that's a really good question. I think my colleague Margarita in the part 2 is gonna really dive into that one as well. But I think overall, I think we shouldn't focus on that coverage number, to be honest. Just focusing on that number, I think is sort of if you have a high coverage number, that might give you a false sense of security. If you have a low coverage number, it doesn't really say anything about maybe your process. So and we also find that there's a lot of sort of analytical pressure or stress on that ELISA kit or that ELISA reagent alone. That's why we have this holistic approach, saying, well, we want to attack this from different sides. We want to look at the process samples. We want to look at process consistency across batches. We want to show the authorities that, okay, maybe we only have a coverage around 50 or 60, but two things: it detects what we can see and what we can continuously detect in our product. Plus the fact that we have our process in control, because we can show over a number of batches that it's always the same HCP profile that shows up, and that is just part of it. And we can even use this as a tool for if we have process changes, saying, well, we change the process, you scale up, you change the filtering, you change the chromatography, you change site, but the HCP profile is still the same, so we're okay. So I think a lot of these different approaches will be worth presenting to the authorities going forward, and not just focusing on, okay, we have coverage in all 4 quadrants and a number. That would be my take on it.
Yeah. Did you get any feedback from the different authorities on your different approaches?
Well, that's the thing, actually. We didn't get a lot, but again, I think as a bit of a cliffhanger, I will leave this to the part 2, where we will have more dive into the regulatory feedback.
Mm-hmm.
But we did get a little bit of feedback.
Yeah, so see, we got lots of different questions. We got some questions on the mass spec method. So about where did the question go? So can you explain in more details on the HCP quantification using LC-MS? For example, how do you select peptides, charge states, or isotope for quantification? So Søren is pointing to me as the mass spec guy. So what we can say for the quantitative mass spec analysis that we have used here in Genmab's project, we use a method called this data independent acquisition, or SWOT as Sykes called it. So it's a very robust and sensitive method to detect these low abundant HCPs. And then to quantify the HCPs, we have added some known protein standards in known amounts to the sample before we start any sample preparation. So we use these as internal calibration curves for the quantity. So of course, you can say the quantities are normalized against this standard. This standard might be more or less representative of the unknown HCPs. So it's not exact absolute quantification, but it's a reproducible quantification where all HCPs are quantified against the same calibration curve. So when you think about how an ELISA works, you also have one calibration curve where you quantify all the HCPs against this. Except for an ELISA, you don't have the curves for each HCP. You do in mass spec. You have the numbers for each individual. So yeah, you can say the principles are a little bit different in ELISA and MS. So also the numbers are not expected to be absolutely the same. Maybe the accurate amount is not so important. It's more reproducibility of the assay that's important. Yes. So looking more into the future, we have more what's coming in the future. So this USP chapter 1132.1. When it's finally released, what effect do you think it will have on the industry and how you look at HCPs?
I think actually it will have quite a bit of impact because I feel that chapter is sort of always already a little behind in a way how some parts of the industry actually wants to move. We of course see some conservatism in the industry, but we also definitely see some people who are really interested in moving this field forward. We could just see the number of questions here so I would say this will change the field a lot. I think when I talk to sort of more conservative forces, they always refer to 1132 and say, well, we need to do 2D gels. But I think now we can actually refer to 1132.1 and saying, well, let's not do 2D gels, let's do MS. Mm-hmm. So I think that will have a huge, I hope that will have a huge impact.
Yeah. So, yeah, there's one more question here on coverage, but that's actually on HCPs being present in the drug substance. I think this is one of the first time we see that you do a coverage on impurities in the product.
Yes. Will you make some comment on that? What does that mean for your strategy, rather than just doing on an early harvest sample?
Yeah. Well, again, I think it sort of underlines. Well, maybe the coverage number in itself is not that important, but it's actually that you can show that you can detect what is in your product, and that it's not a problematic one. I think that is probably the most important part, and also that we can see that, you know, down through the process we continuously have the same HCP profile. I think that is really important, and I think that is the main part of the story we would like to tell the authorities.
Yeah. So yeah, we have lots of questions, and I'm not sure we have answered all of them. So I think we will go through them after the webinar and see if we have addressed all of them. Otherwise, we will contact you by email. So, but I think, Søren, your boss, he asked, or she asked a very good question.
He did.
Do we have any potential problematic HCP in our process?
Yeah.
So you did a lot of work.
We did a lot of work for that. I think he expanded a little more than he thought it would be, but but I'm actually pretty happy that he asked me that question today, because when he first asked me, I couldn't answer him. I couldn't tell him, well, 2 years down the line we will have stability issues with this because it degrades our excipient or degrades our product. I couldn't tell him, but now I can.
Yeah. So very encouraging talks, and we are looking very much into the future. As a mass spec company, we are of course excited and happy to see the effect on your project. So
thank you.
So, and likewise, if you have more questions after the webinar, please come back to us, and we will be happy to discuss your questions. So with that, again, thank you.
Thank you
very much for a great talk, and have a nice day. Bye.
Bye.